Hello, my name is Olivia Dragu, and today we'll be discussing diabetes mellitus type 2. So, what is diabetes mellitus type 2? It is a chronic disorder characterized by insulin resistance. It is the gradual onset disorder with many factors associated with causing it. So, the etiology, like I said, that there was many factors contributing to this. These would include genetic predisposition, which is most common in individuals who are over 45 years old, who are African, Asian, Hispanic, or American Indian. Obesity is another factor, as well as sedentary lifestyle, pre-diabetic, or previous gestational diabetes. There are also many risk factors that are associated with diabetes once you get diagnosed, such as neuropathy, kidney disease, osteoporosis, or cardiac or vessel disease. So the prevalence of diabetes type 2, it accounts for 90% of all cases that are diagnosed with diabetes. So how do you get diagnosed with diabetes? This would happen by getting a blood glucose test. It would be getting your A1C checked, which is your blood glucose within the past 2 to 3 months. You can get this done by fasting or at random. To be positive for diabetes type 2, it would be 125 milligrams per deciliter or over. And then at random, it would be 200 milligrams per deciliter or over. Blood glucose tests would include blood glucose concentration, oral blood glucose tolerance test, or HbA1c. There are also other tests that are done to test for the autoimmune disorders, such as celiac or thyroid disease disorders. So, some signs and symptoms of diabetes type 2 is fatigue, recurrent infections, wounds not healing in a timely manner, visual changes, increased appetite or thirst, and unexplained weight changes. The possible complications with having diabetes type 2 would be hyperglycemia, hypoglycemia. Hyperglycemia is high sugar, hypoglycemia is low sugar. Increased risk for infection, cardiovascular or peripheral vascular disease, retinopathy, nephropathy, impotence, and acceleration of arteriosclerosis. So again, with the risk factors, you can also have risk factors taking medications. These medications would be your corticosteroids, statins, atypical antipsychotics, antiretroviral therapy, and anti-rejection medications. Other risk factors are old age, physical inactivity, previous gestational diabetes, as I said before, and stressful life events. So with all these risk factors, there are ways to prevent some of them, not all of them, with having the genetic predisposition, but with the modifiable risk factors, you can prevent these by exercising regularly, eating healthy, and checking your glucose levels either once a day or a couple times a day, and finding good ways how to cope with stress. For treatment of diabetes type 2, the American Diabetes Association recommends 150 minutes of exercise with moderate to vigorous intensity levels. That's per week. In that 150 minutes, resistance training is suggested in at least 2 to 3 sessions. Adding stretching and balance training is recommended for adults, and monitoring blood glucose before, during, and after treatment is recommended as well. The goal of physical activity for people who have diabetes type 2 is to increase their heart rate and have a moderate level of exertion. Some specific exercises. So the resistance exercises should be, you should have about 5 to 10 of them to perform. You should have 2 to 3 sets and 10 to 15 repetitions when starting out. Once the exercises become easier, you should increase the weight and decrease the repetitions to 8 to 10 instead of 10 to 15. You can exercise in a couple of different ways. If you was at home and didn't have any weights, you could use body weight exercises like squats, push-ups, lunges. Or if you did have weights, you could perform bicep curls, chest press, deadlifts. These are just a couple of exercises I picked, but there's many resistance training exercises. PTA implication. So going to physical therapy, this ensures that the patient is performing the exercise correctly, and it also gives them motivation to incorporate exercise techniques in everyday lifestyle, such as picking up an object from the ground, making sure that they are doing that right. It is more common for individuals to come into physical therapy with other comorbidities and complication that was a result from diabetes type 2 instead of them just coming in for diabetes. They would have other complications that are associated from that. And the prognosis would be following exercise recommendations, eating healthy, being in a healthy weight range. Although there are some modifiable risk factors having that genetic predisposition, there's still a chance that they could have diabetes type 2, but majority of the time it is preventable. And this is my reference page. Thank you for watching.